Awesome. Thank you so much, Dr. Heather. It is the moms, one of the physicians who couldn't be with us today. And by the way, as I'm speaking, we are going to have the Q&A now. So hopefully we have time for questions. This is where the microphone is. If you want to work your way up here, we'll have short questions. And I'd like to have somebody from our helper group move some of these chairs. We need 4 or 5 chairs brought forward here, a little bit more behind me. And then I'll ask the morning speakers to come up here. But one of the physicians, Mark McDonald, who's a psychiatrist, child psychiatrist in California, when we were at our initial summit in San Juan, Puerto Rico, and by the way, Global COVID Summit.org, that's where you go to get this. After it's finished being live streamed, you're going to see the new declaration. Initially, Heather and I met on the phone when we started to draft the first declaration, which was a declaration on the rights of patients to receive treatments and the rights of physicians to prescribe those treatments without interference from government agencies. And that's the one that 14,000 physicians and scientists have signed to date, and many more after this event and others. But the new declaration is dealing with putting an end to this vaccination campaign against our children, which, by the way, today, November 6th, is the day that the pharmacies advertised, come get your kids jabbed. If you recall, as a physician, if I called and left a prescription, send my children. So today's a big day to fight against vaccines against children for natural immunity. We're going to have a luncheon session on mandates and then also the treatment. So please go to Global COVID Summit, and it was Dr. Heather Gessling who helped me to draft, along with others, the first declaration. But Dr. Mark McDonald said, wow, okay, I'm going to shut up in just a second here. We're getting some short, that this has been not a COVID pandemic, but a pandemic of fear. A pandemic of fear. And how they've been so effective is that the fathers of America, for whatever reason, became less fathers. They almost took the back seat, and then the mothers were scared. And in many cases, that's what happened with the schools and everything else. It's the mothers who were frightened. And now, thanks to the heroism of people like Dr. Gessling and others on this stage, we're going to destroy that fear and replace it with facts and faith. And now we got questions, guys. Try to keep them short, and I need to bring up at this time Dr. Gessling, Dr. Malone, Dr. McCullough, Dr. Alexander. On the double. There you go. I'm an old Army guy. Hey, do we have any veterans in the audience? Can anyone who's a veteran please stand up? Veterans. A lot of it. Now, anyone who's got a family member on active duty, please stand with them. Please stand with them. Anyone who's got a family member serving on active duty, stand up as well with the veterans. And that's a whole lot of people. That's a whole lot of people. And that's another reason we're here. Have a seat. I'm going to get out of your guys' way, and we're going to hear some questions. Live stream is not working for the FloridaCovidSummit.org. All right. I hope it's working. Someone back there, please. GlobalCovidSummit.org is. Please speak, gentlemen, and let's go. I think that should be working. Is it turned on? Okay, thanks.
Good morning, everyone. My name is Angelo Marini. I'm a research scientist, and I've worked with Dr. Norman Borlaug to develop the world's healthiest whole food. It's the highest, safest natural source of omega-3s, antioxidants, fiber, complete protein, and other important phytonutrients. And basically, we designed this to make the healthiest cells. And I have a technical question. By the way, the product is called a Nutrigrain. And it's a technical question directed against anyone who wants to answer this. What effect does a healthy cell made from essential plant ALA, alpha-linolenic acid, omega-3, linoleic acid, omega-6, and all essential amino acids with strong epigenetic cell walls, phospholipids, organelles, and dormant ALA with attached arachidonic acid have eliminated the spike protein in COVID viruses. In essence, does a healthy cell help against the virus?
Okay, so let's interpret that question. I think you want to talk about healthy cellular function and the immune system. Yours, Mike's?
So this is Robert speaking for myself. I think we can all agree that one of the great deficits in the messaging from the Public Health Service has been the failure to emphasize health and wellness and recognize the importance of eating properly, having the right nutritional balance, and in particular, vitamin D, okay? So I thank you for your comment. I hope I endorse the logic of, and I think we all do, of healthy living and healthy eating, and in particular, because we're speaking, this is CME again, we're speaking to the docs. Get your patients' vitamin D levels checked, okay? And bring them back up to, what's the right level, 50?
60. 50 to
Over
60.
50 nanograms per mil. So I have this from the expert, and I think that's an incontrovertible source. So over 50 nanograms per mil of vitamin D, please, all your patients, and it will make a big impact on their susceptibility. Over.
Thank you very much. Next question.
I'll just add to that really
Thank you.
quickly. Myself, and I want to recognize, I have Brian Tyson and others here. You know, our collective experience now is in treating thousands and thousands of patients. And so we have the clinical observation that COVID-19, the illness, is a tremendous catabolic strain in the human body. And so it should be unsurprising that there isn't for people to understand that there's a great need for micronutrients and vitamin supplementation, not only in the prevention, but probably in the treatment and certainly in the recovery phase. So this is an opportunity, and I want to give my sincere endorsement and thanks to the naturopathic physicians and integrative physicians who really took some bold steps to step out and treat COVID-19 where many of the allopathic physicians didn't.
Thank you. Yes, nutrition is not something that's taught in medical schools, but our medical students that come to my office hear a lot about it. Next question.
So this question's for anybody out there. I'm an operating room nurse, and we've been seeing an uptick since the 65-year-old and olders have gotten the booster shot, that they come to the hospital with a subdural, and the immediate response from the family members that they just got the booster 2 or 3 days ago, they said they were like a brain fog, became ataxic, fell subdural after the booster shot. Is there a correlation with that?
Well, Dr. Malone gave his personal testimony, but I want to let you know in the journal Hypertension, which is actually one of our better cardiology circulation family of journals, is a clear report of a population of individuals who take the vaccine who have a marked increase in systolic blood pressure. And once it's beyond 180 millimeters of mercury, the brain loses autoregulatory control, and there can be intracerebral hemorrhage. And on Laura Ingram, during the spring, there was a woman, age 72, who came on. Now, it wasn't a subdural hematoma, but it was actually a subarachnoid hemorrhage. And in fact, she required a craniotomy and evacuation. She's devastated on the left side. The family's called me since that time. I've reviewed the paper in Hypertension. In our circles in Dallas, we've had a young man who's age 42 take the vaccine, second shot 2 days later, aortic dissection requiring thoracotomy, and he's now ruined after. This is a perfectly healthy individual. Beware of these acute hypertensive responses. They are idiopathic. They can be fatal. I think even dizziness and general sickness after the vaccine can lead in our seniors to falling and getting subdural hematomas. So the vaccine could be in the causal pathway.
Excellent. Next. Thank you.
Hi, I'm an orthopedic surgeon from Wisconsin, proudly helping Molly James with telehealth for COVID patients. Thank you for what you do. My question to the panel is on blood transfusions, organ transplants. Should the unvaxxed be concerned about getting those products from the vaxxed, and should they be segregated?
Great question.
Well, I can tell you, I'll just jump in real quickly on this. We became aware of the possibility of blood being contaminated either with circulatory spike protein or with the lipid nanoparticles themselves this spring. We wrote letters with very credible pathologists on our team to the American Association of Blood Banking and the American Red Cross, and certainly in Dallas to Carter Blood Center. They all recognized our concerns, registered our concerns, and then did nothing about it. And as we sit here today, someone who's freshly vaccinated can donate a unit of blood. The only solace I would give you is there's so many people now who've either taken the vaccine and have some circulatory antibodies, or those who recovered. It's possible that the antibody pool, in a sense, with respect to pooled blood products, may mop up the spike protein, but I still think on the individual units of packed red blood cells, there's a concern.
Hi, my name is Paul Schaffner. I am a layman, but I'd like to thank you, Dr. McCullough, Dr. Malone, Dr. Gesling, also Dr. Alexander. Thank you for your talks because it's been very important to me. The one thing we all share here, absolutely without question, is a sense of aggravation, tension, frustration. I've had a lot of that. 20 months ago, I had ivermectin and doxycycline in the back of my trunk. I was handing it out to people who said, I don't feel good, I feel sick, I've got relatives that are very sick. I'd hand them out ivermectin and doxycycline. I'm not a physician. My graduate work was in accounting, finance, and banking. But I do a lot of reading. And I must tell you all, I'm tickled to death to be here because it's cathartic. I feel great about it. But are you familiar with, and I want to ask a question, make it short. I realize the smarter you are, the shorter the question. So I'll try to ask this. Are you familiar with Dr. Luc Montagnier and his studies at the Pasteur Institute in Paris?
Of course.
Okay. He said that the spike protein, the vaccinations themselves, as you have said, Dr. McCullough, the vaccinations themselves are bringing in the spike protein and the receptors, and they're creating the variants. And he said he's absolutely going to prove that the vaccinations are creating the variants. I think in your own way you said this today.
Yeah, so I know Luke fairly well, have for about 3 decades. He is getting a little on, but I highly respect his willingness to be outspoken and his various comments. He's aligned with, most of us think of Geert Vanden Bossche as the leader in this. And the evidence in my mind is quite clear that the vaccination is, with the spike antigen, is driving selection of basically supervirus.
Is it true, and this is very important to me because I have younger friends, I talk to women who are young and ready to have children, and I understand from the reports I've read, and this is very important to the audience as well if you have childbearing women around you, that between 70 to 90% of women who get the vaccination either become infertile or they have miscarriages in the second trimester. And if that's true, I think the audience should be aware of it.
So the data on the miscarriages in the first and second trimester are still in progress. There is reports, but we try to stay science and fact-based. The truth of the matter is, as acknowledged by the FDA in the Comirnaty licensing letter, in which BioNTech was specifically directed to perform additional studies in pregnancy and for birth defects, as well as safety in children, because there was insufficient data available. The CDC put out a paper, it's important to remember that MMWR is not really peer-reviewed, okay? So the CDC can say a lot of things, and they do, but that is not the last word. You can think of it as a first draft of history in some ways.
And can I interrupt?
In terms of the pregnancy risks, although the CDC has asserted that they are safe based on a very limited study that was weighted towards third trimester pregnancy and was a very short duration, the FDA itself says that we do not have sufficient data on safety in pregnancy and birth defects, full stop. Now, what is known, and I think increasingly clear, and I was fascinated to find when I did my rabbinical testimony in New York the other day, that the rabbis are all exquisitely sensitive to the issue of dysmenorrhea. And we don't need to go into the details of Hasidic Jew policy, but suffice to say the rabbis have personal, direct, daily interaction with all the people within their flock and are acutely aware of the dysmenorrhea and quite concerned about it, because the dysmenorrhea equates directly into loss of fertility, which is super important to the Hasidic Jew community, which is why, I don't know if you guys saw on Twitter, but the Hasidic Jew community, the fundamentalist community in New York, has come out with a clear and unequivocal determination from the rabbinical court that there shall not be vaccination in children and there shall not be vaccination in young women, and they caution use of vaccine in all adults. But they are particularly aware of the fact that we are seeing this menometrorrhagia and other disruption of menstruation, which unfortunately has been repeatedly dismissed as hysterical women. And I can't believe it when I hear it, but it happens again and again and again. The press is presenting, and others, public health officials, are presenting what women are reporting as hysteria. This is a rude word. It's a rude word. I mean, it feels like we're back in the 1950s. So I agree with you that the issues about pregnancy, safety in pregnancy, and birth defects, and alterations of menses, and as Dr. Cole will tell you, surprisingly, in the postmenopausal, we are seeing an unusual uptick in, let's say, reinitiation of cycling. And that in and of itself is worrisome. So your point is well taken, and I hope I've addressed the scope of your content.
And
Thank you very much.
we have to stop. Folks, there will be questions, but it was a very big oversight by me. I'm going to have Dr. Gessling, and then we have something that needs to happen. Please, Dr. Gessling.
So I'm going to have two comments about what you have said. The first one being that you were giving out ivermectin and doxy from your trunk. This has
Testing
happened.
1, 2.
This is what has happened in this country. The patients know what they need, but they can't get it. And so they have resorted to treating themselves. That's what led to the situation that we have with patients utilizing other forms of ivermectin. But this is what the governmental agencies created. And so the other thing is with regard to women's health, all of the comments that Dr. Malone have said, I reiterate that as a family medicine physician, I have experienced an astounding amount of patients coming to me with severe disruptions in their cycles, and I give them an ear, and I tell them what I think is causing it, and I ask them what their gynecologist or obstetrician has said, and you can guess what they tell them. It has nothing to do with the vaccine. It's stress, or you're going through menopause at the age of 35 or 30. And so what has happened is this exact same thing that he said, which is they're dismissed. How awful is that after we have worked so hard for women's rights and the women's voice, and then they get denied the ability to tell what is happening to them. So the medical community has created an enormous amount of distrust, and people are leaving that community en masse, but hopefully they find physicians like us.
So we got a whole lot of questions coming up. We've got to kind of rock through them. We'll be here forever.
Dr. Malone, I think what I'm going to do is we are going to give, with Dr. McCullough's wise, sage advice, a few more questions. But what we totally forgot this morning was one of our great rock star guests and scientist, Dr. Ryan Cole, has a fantastic presentation. So we got to get his in here because he's part of this whole day and you want to hear him. So please just keep your questions short. And we got maybe 3 more questions and then we're going to go to Dr. Cole.
Well, we've all heard that the VAERS report is underreporting. And I'm very concerned why the hospitals, even though the doctors are supposed to be reporting their vaccine injuries that they see in their patients to VAERS, why are they denied by their hospital administrator or whatever, why are they being denied to report it? I'm hearing that from a lot of different people and doctors and hospitals, that they're not even allowed to report it.
I can't confirm or deny that there's active suppression of reporting, but I can tell you there is, I think the appropriate term is called willful blindness. I think physicians have bought into this idea that they were going to be saved by the vaccine. And it's very hard now. We have 1 million doctors who have bought that story, that they thought the vaccine was going to save America. They've bought into this dream that the vaccine is both safe and effective. And it's really shattering their dreams to figure out that the vaccine is not effective enough and doesn't last long enough in most individuals. And it's shattering their dream that the vaccine is not sufficiently safe. Doctors should be the safeguards. They are the shepherds of the flock. There's no doubt about it that all of you can help by demanding these VAERS reports happen. If you come across anybody's vaccine injured, triple check to be sure their doctor or caregiver has actually filed a VAERS report, and start to really push the healthcare providers to do that or do it yourself. We have data from the American College of Pediatrics before COVID-19 suggesting 14% of VAERS reports were actually done by patients themselves. Right now, that's probably holding out. So what we know right now with the 17,000 deaths after the vaccine, the 250,000 hospitalizations or urgent care visits, the vast majority are done by doctors and nurses who are concerned the vaccine caused it. But it is just the tip of the iceberg, and the number is certainly far greater. Everybody can be active here by talking to everyone you know is vaccine injured, and let them basically do their own fact-checking to be sure that their case has been reported to the CDC.
Thank you. And by the way, for the next question, it is true that if you're vaccine injured and you have a stroke, or you have a female reproductive issue, or you have myocarditis, you show up in the emergency room, they're never going to ask the patient, did you receive the COVID vaccine? That is never asked. And yet, if you're unvaccinated, they're going to ask you if you're unvaccinated. So there's a double standard in medicine, and you're right, we're woefully underreporting the complications. Yes, ma'am.
Thank you for all you're doing. 2 quick questions, I think. We've heard a lot about shedding. Is there actually some truth to the fact that the vaccinated are shedding? And what danger is there to the unvaccinated? And the second question is, has there been any evidence of graphene oxide in the vaccination?
Great question.
Thank you for
Dr.
that.
Cole.
You know, scientifically, we know from studies from Ogata et al. At Harvard that the spike protein circulates after one gets the shot. So we do know that the spike is produced and circulates. Now, in the Journal of Immunology a couple weeks ago, there was an article that showed that there are about 4 months worth of spike circulating in exosomes after the shot. Now, the amount of spike one would have to be exposed to induce a response in somebody who hasn't received the vaccine is still up to science. But exosomes can be exhaled, there's no doubt about that. We know from studies in China, in the sweat of individuals that had COVID, that the spike protein showed up in their secretions. There is such a thing as self-perpetuating, self-spreading vaccines. This has been researched. They've used it on rabbit populations to actually expunge the fertility of rabbits. And that's in the medical literature. The amount of spike being shed, we're still studying it. Are people having effects from being around people post-vaccination? Absolutely. Do I believe them? Absolutely. Is the science still out as to the mechanism or how much? Yes, the science is still out.
Thank you. And the other about the
graphene oxide. Maybe, maybe not. There's tons of things in your daily use that there's graphene oxide in them. To me, it's a non sequitur, it's a red herring. What I do know is there's mRNA in these shots that is inducing damage in many people. So whether graphene oxide is there or not, I don't worry about it. In the sense that the shot isn't necessary now. Early treatment saves lives. Don't block your doctors from using early treatments. Don't give this to the children. That mRNA in and of itself is necessary and sufficient to be damaging in many people. So to me, red herrings, there's plenty of things to look at. If you research graphene oxide, you'll find you're exposed to it in your daily environment in many ways, shapes, and forms. But the mRNA in the shots, that's more concerning.
Excellent. Thank you, Dr. Cole. Great. 2 more questions. Maybe 3 because there's a doctor behind you, and then we have to really stop for the next group. Okay, go ahead. My question is for Dr. Robert Malone. You had mentioned, sir, that the polyethylene glycol surrounding the lipid nanoparticle falls off after it is injected into the body. It has been postulated, however, that if the polyethylene glycol remains on the lipid nanoparticle long enough, and you have enough antibodies against polyethylene glycol, that it could perhaps block the delivery of the messenger RNA. In other words, vaccine failure and no adverse reactions. Your comments, please.
So you just said the keyword hypothesized or postulated. And there's a lot of potential mechanisms that are postulated, including the existence of reverse transcriptase resulting in integrated mRNA into your genome. But the clinical significance of these hypotheses and postulates remains unproven, and in many cases is unlikely. We have to live in the world of whether things are clinically significant. Now, I love to live in the world of could be and all the hypotheticals associated with molecular virology. I find it fascinating. However, in the case of the PEG, the acyl side chain is so short that if you did have binding antibodies in those, remember many of us have been exposed to PEG. PEG is commonly used in stealth liposome technology, has been for years and years, been safe in stealth liposome technology, but there is a subset of people who will have an anaphylactic reaction to PEG. That is true. Okay, so if you do have binding antibodies to PEG, the probability is quite high because the acyl side chain is so short that what they will do is pull the PEG off of the lipid nanoparticles. So personally, science, anything can happen. The question is it happening at a clinically significant frequency, and is it damaging patients? And I think the honest answer is we don't know. Is that fair?
Thank you. That's great. Thanks.
Hi, I just want to thank you all for everything you've done. I'm a patient of Dr. Littell, so I travel far away to come here, and I want to thank you all for everything you're doing. I just have a specific question for children, especially someone with PANS or someone with autoimmune. Someone was saying that because the COVID vaccine doesn't have a viral vector, that it's safe, and they'd rather have the vaccine than have any long-haul COVID afterwards. And I'd love to hear your thoughts on that.
Early treatment saves lives. For people who are immune suppressed, and I'll get to this in my talk, the shots are for a legacy variant that doesn't even circulate in humanity anymore. These children that are immune suppressed may not even be able to mount an appropriate response, and if they do, it's going to be to the wrong protein anyway that's not in existence. The Delta's here, not the legacy initial wild-type variant. The mechanisms of action this afternoon that many doctors will talk about of the early treatment medications block the binding of the spike, block the replication of the virus. These children, just like adults, are eligible for early treatment. Of all the patients I know of who have received early treatment, it is rare to get long-haul symptoms, especially if you start early when they get the virus.
So what kind of early treatment do you do? And then
Well, that's what we're going to talk about. That's this afternoon. You're
Stay tuned.
Stay tuned.
There's a teaser.
Are any of you physicians besides Dr. Peck? Okay, one physician. Dr. Peck, go ahead, please.
Thank you very much. My name is Rebecca Peck. My husband and I are family physicians. We're in Ormond Beach, Florida. We've been practicing for years. We're employed physicians now. That's what happened with the Affordable Health Care Act. That's why you don't have more physicians speaking out, because they're scared. Because I'm going to lose my job because I won't take the vaccine, and I'm going to lose my job because I'm on social media speaking the truth. But it's worth it. You've got to. As these people know, they've lost their licenses. Anyway, we've had 1,100 people with COVID, no deaths. Let me repeat that. 1,100 people, no deaths due to early treatments. You won't hear that. You won't see that on the front page of the paper, but it's true. Monoclonal antibodies, Regeneron, we have people, we do the testing in our parking lot, we send them. Governor DeSantis has made 70 stations available. When my patients travel to Massachusetts or liberal democratic states, they have 1 or 2. Come on, this is political, and they've made it political. My question is, Dr. Malone, you said that if somebody got the vaccine and then got the natural virus, there might be immune complexes made. But in our people, they have the virus and we send them for the Regeneron, the monoclonal antibodies, but they all recover within 48 hours. There don't seem to be any sequela from immune complexes. Can you explain why?
Yeah, I think what you did is invert what I said. What the gentleman is suggesting in that review paper, and I think there's a lot of merit to it, is if you are naturally recovered, so so I think what you just said is vaccine first and then virus. What is being hypothesized is if you have natural immunity, so you have high levels of diverse virus, and then you receive the jab. With the jab, you get a bolus of protein expression, a very high amount of protein expression, probably much more protein in the circulation than you get with a natural infection, okay? And so you get this whopping big dose of protein that's in your circulation. You already have high level of antibody. You will get immune complexes. The key thing here is that the virus moves into your body and gradually grows, gradually expands, okay? There's an onset curve. With the vaccine, if you imagine the curve of spike antigen with the virus itself is going to be kind of like that, okay? The curve with the vaccine is like that, okay? You get a whopping big bolus. It's as if you took a whole bunch of spike protein and jammed it, intravascularly. That is the difference, and I think that Jill really is, as far as I know, the first person that kind of came up with this insight about the difference between natural infection and the vaccine. It's a fundamental difference. It has to do with stoichiometry. I hope that helps. But I'd like to say something else. Okay, I'm going to extemporize for just a minute and riff off of what you just said. In my opinion, I'm just speaking for myself, our healthcare system is failing us. Our HHS has failed us. I think the only solution, the solution that we have as physicians, and it's the purpose why we're here, is to help train you as people administering early treatments, life-saving drugs, okay? It's folks like you thinking globally and acting locally that are our last bastion. They are what's going to save the patients. And people often ask, what does it look like on the other side when we realize that our hospital systems are failing? I mean, can you imagine what Baylor has done to this guy? He's an amazing physician, amazingly productive. He's got a endowed chair at Baylor that he's paid for, and they're trying to railroad him, okay? It's just shocking. The failure of our hospital system, our insurance system, our HHS system, it is catastrophic collapse. What does it look like on the other side? To my mind, I hope, what it looks like is doctors like you and your husband are going to grow their clinics, and they're the foundation that will build a new tomorrow in terms of healthcare delivery system.
True.
And I want to acknowledge you for your leadership.
Thank you, Dr. Malone. Thank you. Independent physicians, if there are anybody out there that wants to join independent practices that isn't order, or you know people, call me or Dr. Peck. We're looking for help. Dr. Gessling, we need more help. All right, on that note, I'm going to bring up Dr. Ryan Cole and ask the rest of you, thank you for an amazing panel.
It's the stage left. You got a mic.